Hello again, George here with another follow-up to my acoustic neuroma surgery that I had just over 7 weeks ago. And it's been about 5 weeks since my last report. I think I've made a lot of progress since then. Just to recap a little, the acoustic neuroma surgery that I had was successful. A 2.5 centimeter benign tumor was removed from my left hearing nerve. I did wind up losing all the hearing on my left side, but I am getting used to that, and hopefully that will be the only long-lasting side effect that I have. Other side effects that I've had are dissipating, have disappeared, or becoming more manageable, such as headaches. Used to get them several times a day after my surgery. Now maybe 1 or 2 a week, and they're not really too severe. I've been sleeping a lot better. The first month was more challenging because of headaches and because of my eye drying out, which I'll talk about more in a minute here. My strength and my balance have been real good since my surgery, but they're getting better every day. I've been able to return to a lot of the activities I enjoyed doing before my surgery, such as riding my bike or hiking, even I've hit some golf balls already. Still have a ways to go, but I can tell that I'm making progress, and I'll be able to enjoy pretty much all the physical activities I enjoyed before the surgery. Even been able to do a little light running, jogging, to get my heart rate up and get some good exercise in. I've done some push-ups already, sets of push-ups, without any ill effects. So I'm pretty encouraged by where I'm at physically right now. The biggest side effect that I'm dealing with is temporary facial paralysis on my left side. I think it's improved, but the change is very slow. The progress is very slow, so it's hard for me to see a difference. People that I know tell me that it's gotten better in the last month. And looking at the video that I made in 2 weeks, it does indeed look like I'm making some progress. I've been using some eye drops. Well, I've been using lots of eye drops because the biggest issue I'm facing now with the facial paralysis is that my left eye gets real dry, and I need to constantly put eye drops in that eye to keep it from getting irritated. And at night I use a lubricating gel, which I don't use during the day because it makes my vision real blurry, and it keeps it blurry for a while, but at night that isn't a concern when I go to bed, so that's why I use the gel then. During the day I use a more conventional lubricating eye drop. It may cloud my vision temporarily, but it doesn't last as long. But the relief is good. So I'm doing that, probably using those eye drops several times a day, maybe once an hour or even more than that. The facial paralysis also impacts my ability to smile. I can kind of grin. It's fairly normal. If I try to show too many teeth in a real smile, it has a tendency to be more lopsided. But all in all, it's something I can deal with temporarily at least. I have a little trouble eating sometimes and drinking because I can't close my mouth real tight on the left side. It feels a little awkward. Doesn't really make too big of a difference to me. I don't really notice it too much, but I do notice it. So all in all, I'm pretty happy with where I'm at. The vision impacts me because it makes everything seem off. It's hard to explain. I mean, I feel strong, I feel balanced, but there's just something strange about, maybe it's because I'm not focusing as well, maybe it's because I'm losing a little peripheral vision, but everything just seems a little bit different. But I am going to return to work here in about another week. We'll see how it goes. I think it should be all right. If I need to I'll try to balance the time I spend at my computer if it starts to, if it's too difficult to do too much work on the computer because of the vision. But other than that, I am looking forward to seeing how I do, and I've been out for about 2 months, so I'm ready to go back. So one other thing, I've been driving for a couple of weeks now. At first I was a little concerned, but really it was pretty easy to get back into driving again. My vision again, I just have to make sure that that before I go I don't put in any kind of lubricating gel that's going to impact my vision. But for the most part, I feel like I'm driving pretty safely. So again, I'd like to thank all my family and my friends and my coworkers, my medical support team who have been so helpful during the last couple months and so patient with me. And I don't know where I'd be without them. So I'm really thankful that I have that support. And anyone out there that has the same condition, hopefully you have the support you need too, because it's not something you want to go through on your own. So again, I'm very thankful. I will give another report here, maybe another month or so, and we'll again document where I'm at and hopefully see even more improvement at that time. So thanks for watching, and take care.